These are exciting times for the children of the world. We are 2/3 of the way through the attempts to attain Millennium Development Goals, whereby we improve the health of the people of the world. And there are many children that are already being helped by this. These are also exciting times for people who professionally take care of children. Annals of Tropical Pediatrics comes out of the Liverpool School of Tropical Medicine. That was the world's first school of tropical medicine, and it has a great heritage. But now, Annals of Tropical Pediatrics is taking on a new face, and now we're starting under a new journal with a new title, Pediatrics and International Child Health. These are indeed exciting times. I'm Phil Fischer, Professor of Pediatrics at the Mayo Clinic in Rochester, Minnesota in the States, and with me are Liz Keating and Megan Chock, medical students here at the Mayo Medical School. We had the privilege of writing an article that appears in the last issue of Annals of Tropical Pediatrics as we move on to the new era with Pediatrics and International Child Health. In that article, we talk a bit about Millennium Development Goals. Megan, what are the Millennium Development Goals?
Well, Dr. Fischer, the Millennium Development Goals were created in 2000 by the 191 member nations of the United Nations, and they aim to improve child and overall health of the world using 1990 targets. And our goal, or the United Nations goal, was to achieve them by the year 2015.
So we're 2/3 of the way into our attempts to hit some health targets to affect the children of the world. Do you think we're doing okay?
Well, we've done okay in some respects. And the first Millennium Development Goal would be to eradicate extreme poverty and hunger, and we're actually on track to achieve that goal because poverty has been reduced from 46% in 1990 to 27% in 2005. So that's been exciting for us. And another goal in which we've seen success is the 7th Millennium Development Goal, which aims to have the proportion of people without access to safe water. And we are on track to achieve that goal as well.
So there's good progress to meet real goals that are going to help children be healthier. For years, we've often looked at child health as measured by survival and how many children live. Liz, how are we doing with helping more children survive?
You know, Dr. Fischer, we're doing pretty well, but we have a long ways to go. The Millennium Development Goals are 8 different goals, and one of them, number 4, actually relates the best to children. Millennium Goal number 4 is to reduce child mortality age 5 and under by 2/3 in 25 years. And so far, at the year 2010, we've been doing pretty well. We started out in 1990 with 11 million children dying, and we're now at 7 million children dying. So we've decreased the amount of child deaths by 4 million. So if you look at the percentage-wise, we've decreased the deaths by 30%, but we still have another 33% to go. So we have another 4 million children to save in the next 5 years.
So a lot of progress has been made, but this is not just statistical progress, but we're talking about millions of children that otherwise would have died before reaching school age that are now surviving. What are some of the other challenges still waiting for us with some of the other goals?
Well, the 5th goal is to reduce maternal mortality by 3/4. We're doing okay on that, but we have a very long way to go on that goal as well. Currently, we are at 1.3% of decreased deaths of mothers, and we need to get to 5.5%. So we have about 4% more to go.
So there's been progress, but we're not quite meeting the goals. Lots of people have been helped, but there is still more even to meet the goals that we need to help. What are some of the other goals, and how are we doing with those?
Well, in terms of the health and welfare of the world, we can't just do it individually. It takes more than just one person doing one project. We need to unite and kind of come together. And Millennium Goal number 8 is about developing partnerships in the world, and we're doing pretty well with this and all kind of coming together to try to achieve the goals.
So these are partnerships not just between patients and physicians, but between what sorts of people?
Well, one of the main focuses is to enable access to essential medication. So this would involve not only nations, but also the drug companies within nations, and working across borders to develop those partnerships and create economic incentives for the drug companies to actually be able to market these medications in developing countries that don't have their own stable market.
So we've made progress, and there's lots that we can celebrate as we see progress that's been made, but there's still a lot of work to do to meet those goals as well as to help many more people. Are there particular parts of the world that are doing better that we can learn from?
In terms of Millennium Goal 4, which is to reduce child deaths by 2/3, Asia is doing particularly well, but Africa still has a very long way to go.
So there's progress being made, but a lot of work to do as we join together between professionals, between governments, between business organizations, as we all work together for the children of the world.